Okay, all right. Now I'll call the meeting of Carbon County Board of Commissioners to order. Please rise for a moment of silence, prayer, and the Pledge of Allegiance. Oh God, thank you for the gift of this new day. Thank you for the blessings of this life. Family, friends, work, and purpose. Guide us as we discuss, plan, and dream together. Help us to make wise and just decisions. Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
These proceedings are being recorded for the sole purpose of constituting the accuracy of written minutes. Tapes are reused, eliminating recorded records of these proceedings. Approval of the minutes of the previous meeting held March 26, 2020.
So moved. Second.
Mr. Arner?
Yes.
Mr. Lukasevich?
Yes.
Mr. Notstein?
Yes. This time we are expecting a phone call from a doctor from St. Luke's Health Network. So as soon as the phone rings, we'll stop whatever it is we're doing and take the call. Okay? Are there any guests concerning county business at this time? Okay. Hearing none, we'll move on.
The report of executive sessions held.
There were 2 executive sessions held, one on March 26th at 1:30 p.m. for personnel, and one on April 1st at 10 a.m. for personnel.
Department reports. The budget transfers.
Move to approve. Second.
Mr. Arner?
Yes.
Mr. Lukasevich?
Yes.
Mr. Notstein?
Yes.
There were no supplemental appropriations. Expenditures, approval of payroll check numbers 72278 through 72316, and direct deposit check numbers 6018241 through 60. Well, stop it right there.
Recess. No, not a recess. Okay. Morning, doctor.
Good morning. How are you
Good.
this morning?
On the line, we have Dr. Jeff Girari, Medical Director for Senior Vice President of Medical Affairs for St. Luke's Health Network. And thank you for joining us this morning to give us a little bit of insight on some of the issues. And I know one of the biggest questions we've had and coming from people is because of an incident when a person tests positive for COVID-19, when is that person considered fully recovered, which is what prompted some of our calls, and perhaps you can explain that to us a little bit better.
Well, first of all, thank you for inviting me, and I'm happy to try and give you whatever information is available. I think it's also important to start off with a disclaimer that the information that is available and that we use is the latest scientific evidence, and a lot of it is based on CDC recommendations. As everyone here realizes, this is a novel coronavirus, which means that there is not a lot of experience with this. The world's experience is only about 3 months, and therefore the recommendations and some of the guidelines are changing almost on a constant basis. So whatever I'm going to say is the latest, but it's also subject to change. So in terms of that question, which is a very good one, the standard that is being used right now by both the Pennsylvania Department of Health and the CDC is as follows. That in general, you can return to your normal activities at least 7 days since the onset of your symptoms, and if your fever is gone without using fever-reducing medications, and your other symptoms are improving for at least 3 days. So in other words, the shortest interval, if you're doing well and not running a fever for at least 3 days and are generally improving, would be 7 days from the onset. Now, I want to premise that by saying that these things should be always checked out with your physician first, because there are some exceptions. And then, one of the definitions is, what do you mean by, quote, feeling well? And so if someone is had a bad cough and just has a very, very mild cough right now, but is basically feeling perfectly fine in every other way, that would be consistent with feeling well. Whereas if you still feel like you are so tired that you can't even walk up a flight of stairs or move around and do your normal activities, that would not be considered feeling well. So you have to be I think, in touch with your physician, and they can personalize it for an individual. Does that help?
Yes, sir, it does. I appreciate that. And I'm glad you mentioned the disclaimer. We all know here that, we can say one thing now, and 10 minutes from now, that could certainly change. So thank you for pointing that out.
You're welcome. That's already happened to me. So,
Yeah. So,
Dr. Gerari, good morning. Commissioner Chris Lukasiewicz. Sir, could you tell us the current testing that the hospitals in Carbon County, or St. Luke's specifically, is doing in Carbon County? What is the normal now return time on the test results for the COVID-19 virus?
all right. Again, that's a question whose the answer would have been very, very different just a couple of days ago. So I'm happy to report that we now have the capability to do some in-house testing. And we received the kits and what we need to do that. It's going through a verification process, and we're hopeful that we'll be able to do this, at least on a limited basis, as of possibly tomorrow. And that has a turnaround time once the specimen is received at our site, and the sites are at our various hospitals. A turnaround time can be as short as an hour or two. So that's the good news, and we expect that those kits will continue to arrive, albeit not in the kind of supply that we would love to see, but we know that that's going to be increasing as time goes on. The other good thing is that we now also have what I would say would be a verbal contract with some of the commercial labs, such as LabCorp or Quest, that have told us that for very vital cases, they can guarantee us a turnaround time of less than 2 days, and we have a way of prioritizing that with them. And then, of course, there's always the state lab that wants to do certain types of testing, and they're still very limited in what they do. And the kind of testing that they want to do as of right now are, for instance, if you have someone in a group home or in a sheltered facility where there could be a potential rapid community spread, those specimens should not go to a commercial lab, but preferentially should go to the state lab, and they try and get that returned to us within 24 hours. So I think you're going to see a lot of progress made on all of these fronts, so that hopefully the turnaround time, which previously could be as long as 7 days, will be shortened to 2 days or less, and very likely in certain priority cases, we may be able to have a turnaround time within an hour or two. So that is very good news indeed.
Doctor, I have one other question. St. Luke's, where do they perceive Carbon County in relationship to the term we keep hearing, the bell curve, when it pertains to this pandemic?
Well, we're all in this together. There isn't any separation right now. The only separation that I can kind of make is when we talk about hot zones, where the greatest concentration of cases is. But that doesn't mean that the next concentration won't be in adjacent county. Example, I think you all know that Monroe County has been a hot zone for us. And that occurred very, very early on, and we know why. The reason was pretty obvious, that almost every case initially in Monroe County was directly related to someone from either New York City or northern New Jersey, or travel to those areas. And that still remains, the case to a very, very large degree. As you all know, though, it has certainly spread out to all of our communities, and that includes Carbon. It obviously includes Lehigh, it includes Northampton County. So we have to assume that we're all next, and that we don't, what we do, and this is where the power of a network comes in, is we have the ability to shift staff, we have the ability to shift supplies, we have certainly a change of knowledge We have the ability to shift patients when necessary among all of our facilities, so that an area that is particularly hard pressed won't feel an undue burden, and we can kind of spread out the issues. And as far as bending the curve, we're all involved in that. As you know, the governor issued basically a lockdown order for the entire state, and that is extremely essential right now in helping us to bend the curve, or we would say flatten the curve, so that we don't get a surge that can overwhelm any healthcare system. So even though we have a lot of flexibility and we have a powerful network, we know that if there were thousands of cases that came on within a couple of days, it could potentially overwhelm a network. And we obviously have contingency plans for all of those things, which we hope we won't have to put into effect. But that's why it is so very important for all of us to stress to our constituents, our public, that this applies to everyone. We want you to stay home. You're going to get this disease primarily from coming in contact with somebody else who has it. If you stay home and you don't go out except for what we would consider to be essential purposes, and I think we all know what those are, such as doctor visits that have to be person to person, to pick up food, to pick up pharmaceuticals, to check on loved ones where there's no other way of doing it. Otherwise, leave discretionary travel for some other time. And if we all do that, we know that curve is going to be bent earlier, and we won't have that. We hopefully won't have that surge that could overwhelm any hospital system. Does that answer your question?
Yes, thank you very much. And the commissioners, this is Commissioner Notstein, and we had that conversation this morning with U.S. Senator Bob Casey and the issues, in particular for the counties here on the eastern side of the state, with the tourism and the people with second homes from New York City that perhaps work in New York City, and they come here and they're living in their second homes now. So that was the topic of discussion this morning with about 8 or 10 other counties that were on the line at the time. So,
yes, and as you know, the eastern part of the state has experienced what I would certainly call a heavier burden than any other part of the state so far, simply because of that reason. I think because of the proximity to what is now is known as the epicenter of this whole thing, which is the New York City and northern New Jersey area.
Yeah, I just have one question that a lot of people ask me, and it's like on the symptoms. A person can get up in the morning and they have a temperature or they have a runny nose. Now you're talking like that 72-hour period. Are they going to have a fever for the 3 days? Are they going to have a runny nose for 3 days, or can it go back and forth? And I don't think anybody ever really explained anything like that. And I'm sure everybody's body is different. But is there a pattern that you're heading to that you're going to be in bad condition in 7 days?
Well, you're absolutely right. And in the sense that it's sometimes easier to go over this in theory than it is in actuality. And what we have done is, in the beginning, I think everybody is aware that we had a fairly what I would call a very focused screening system, that we would not test you unless you had definite contact with a known COVID-19 patient, or you had traveled to an area which was considered a hot zone area, whether it be New York or whether it be Italy, and or certain areas of Washington. That has gone out the window right now as the disease has spread through, and as we understand that people can have this disease and have very minimal symptoms. So what do we do? In this kind of situation, number one, I think it's important to say who we don't test. And that is, there's no reason to test someone at this point in time, and that has been the case, someone who has no symptoms whatsoever. So the so-called asymptomatic group would not be a candidate for testing at this point. The people who would be are people who have any kind of respiratory symptom, and that can be some of the things that you just mentioned, where it is not easily attributable to another known cause. Let me give you an example. We know that right now, because of the warm weather we're having, that the pollen season is out there, and that many of us wake up in the morning and feel a little stuffy. We have itchy eyes and some runny eyes and a little bit of runny nose. That is not COVID-19. I mean, we can almost certainly say that that would be attributable to allergies and certain sinus conditions. On the other hand, the one symptom that we know that seems to be more prevalent than not is fever. And that fever can be as little as 99.8 in some people, because we know that not everybody spikes temperatures over 100, although generally we are looking for temperatures that are over 100, so it's very individualized. That fever can be very transient. Some people have it just for literally a few hours and then don't have it again, and then other people may have it for several days and it worsens. So if you have a fever, if you have any other symptom along with that as well, such as a cough and certainly any kind of shortness of breath, then you'd be a candidate for testing. And we have widened that net, and we're testing more people than we ever would have before, and that's why it's so important for us to have the ability to get all of these test kits that we have, so that we can increase the amount of people that are being tested, and we have a better idea of what's really out there in the community. The other thing that makes it a little bit difficult is that sometimes somebody would ask, what's the period of contagiousness? Well, we talked about when we think it's not. And there's also some evidence that the disease could be contagious for about 48 hours before your onset of symptoms. So, when we're testing people, we're testing the symptomatic people. We know that we're not necessarily getting everybody. So it's a very individualized thing, and what do? So in that, we tell people, first of all, call your primary doctor, because your primary doctor knows you. He or she knows whether you've had some of these symptoms before, whether you've had chronic sinus disease, whether you have allergies, etc. That primary doctor will almost certainly go through some screening questions with you, and then they'll decide, do you need to have a virtual visit? Do you actually need to come in? And if you come in, they may ask to take certain precautions before they see you. They may put a mask on you. They may be wearing a mask. They almost certainly will be wearing a mask. They may decide, nope, your symptoms qualify. You don't really need to see me. I'm going to arrange for you to get tested. And we now have many different areas where you can get tested. You can get tested at any of our urgent care centers. You can get tested at any of our primary care doctors. And if there's any question about this, if you don't have a primary care doctor, you can call the St. Luke's number, which is 1-877 St. Luke's, and ask for option 7, and they will go through these screening questions and potentially arrange for you to get tested if they feel that qualifies. So the answer is not a simple one. It has to be individualized, because we know that the symptoms can vary so much in people. And if we decide not to test you at that point, we're always going to tell you, look, if you worsen, if you start to get more short of breath, and what do we mean by short of breath? Where you can't finish a sentence without gasping for breath, or you find that ordinarily you can walk up a flight of stairs very easily, and now you can't. Or certainly if your mental alertness is less, or you have any issue at all where you're not eating or drinking adequately, then we're going to tell you that's when you need to be seen, and preferably in an emergency room. But otherwise, we're trying to keep emergency rooms for emergencies, and whether they're COVID-19 type emergencies or whether they're the routine things, and we certainly are seeing those.
Okay. Are there any messages that you would like us, other than stay at home, to get out to the public?
Well, I think there are a couple of things that we continue to emphasize, and that is people who don't have symptoms don't need to be tested. That's number one. Number two, your first line of questioning, or to get answers to your question, if you have a primary care doctor, should be your primary care doctor. And if not, we have the ability, as I just mentioned, to be able to screen you virtually, or by calling that number, or by computer. There's a lot of different ways that we have that are an adequate mechanism. So those would be the two things. And then there's really a third thing that I want people to understand, and that is, with this absolute emphasis, and we certainly understand the reasons why, on COVID-19, we don't want people to neglect their routine care. And so, if you're an asthmatic and you're having trouble breathing, if you have chest pain, all of these things, we are open for business. Our physicians are open for business. Don't neglect your non-COVID-19 type care. And if it's something that's very, very optional, for instance, if it's a colonoscopy that can be postponed for a couple of months, we may tell you to do so. But certainly, for those people who have underlying illness that need to have that care checked up on, and if there's an exacerbation, don't neglect it. Be in touch with your physician, and they'll be able to tell you what the right step is to do.
Well, do you have times for one or two more questions, perhaps?
I have all the time you need.
we know
I
you're
think this
busy.
is important. So.
Commissioners, if not, I'd like to open up. We have TV 39 with us today, Haley, and we also have Blue Ridge Cable TV 13 with us. So, Haley, do you have any questions at this time?
Yeah, I think the only other question that I have, you hit on pretty much everything, but I think we're at a point where it has been confirmed that community spread is happening in our area, correct?
That's correct. I think we have to assume right now that community spread is everywhere. And that's why we always tell people to act as if you actually have the disease and don't know it. So that helps to put it into a certain kind of perspective of why we want everybody to be socially distant.
And is that making it harder at all to kind of like trace where cases? I mean, I know we said in Monroe County, like it was easy to tell that almost all those cases were coming from New York and New Jersey. Is it getting to a point where it's harder to tell?
Well, yes. I mean, now that if there are several thousand cases, as there are right now in Pennsylvania, and as we increase testing, just realize we're going to see many, many more cases. They may always have been here, but we wouldn't have tested them necessarily. Let me just see. I just lost my train of thought. So give me that question once more, if you don't mind.
Yeah, I was just saying, with the community spread, how it is happening in our region, is it becoming harder to, trace where?
Yeah. Yes, I understand. Okay, so that's where I was. So the main issue right now is that in the beginning we were talking about containment, and containment means that find each case and make sure that they're isolated or quarantined, and so that it doesn't get out in the community. Well, we're beyond that right now. It is out in the community, and now I think you keep hearing the word mitigation, and mitigation means to try and keep the intensity down and try and prevent this from becoming much more of an issue than what it is. And so, by and large, if you look at how, whether it's the local health departments or the state health departments or even the CDC, how they're investigating spread, it's not necessarily on each individual, but it would be for particular circumstances. For instance, if you have someone in a closed facility like a nursing home, that is something that would be investigated because of the risk to everybody that is in that situation. Any kind of closed facility, whether it's a prison or a nursing home, a group home of some sort, all of those would get priority. But by and large, the average situation right now will very likely not be investigated to any great degree. All of our cases are reported to the local Department of Health and the State Department of Health.
Thank you.
You're welcome.
Haley?
Yeah, my question is, we're hearing so much about social distancing and staying at home except for those necessary trips. What's your advice for when people do have to go to the grocery store? How can people, what do people have to do to make sure they're not spreading and picking up the virus?
Yes. Okay. Well, that, again, is a very, very topical question. So let me first stress the importance of social distancing itself, because nothing else that we're going to do or recommend is going to take the place of that. So what we're telling people is only go out when you absolutely have to. Try not to make 6 visits to a grocery store in a week. If you can do your shopping on one occasion, you're better off doing that. You lessen the exposure. When you are out and you're near people, we want you to keep apart. Now, yes, there has been certain differences from experts on how much apart you need to be. I don't think that that is as important as making certain that you're not close to somebody else. And the current distance that's used is about 6 feet. Secondly, we also say that if you're out and you're in a closed area, we know that if you have to cough or sneeze, we've also given very strong instructions on how not to spread the disease, make sure that it's contained. Then the controversial question comes in, and I think this may be what you're getting at, is should the average person out there wear some type of mask or a bandana, and is that going to be helpful? And I believe you know that the CDC is actively considering that right now, and that's one of the things that can change as you and I are speaking. I'm going to give you my opinion, and again, an opinion is just that, and it's capable of not being correct, but here it goes, and that is that it doesn't take the place, obviously, of the distancing that we talked about, but at the same token, if people who are out in a more closed environment like a store or a counter to take out food, if everybody wore a mask, what would that do? We know that the mask may not prevent you from coming down with the disease if you're exposed to a COVID-19 patient, but we also know that any of us could be a COVID-19 patient and have such minimal symptoms or no symptoms and not realize it. So by wearing that mask, we know that it will help if we actually have it to not give it to somebody else. And if everybody wore that mask for those kinds of situations, I'm not talking about when you're walking outdoors, that's not the issue, but when you're in a closed environment like a grocery store or a counter area, then I don't think that's necessarily a bad idea. Those masks have to be cleaned, and we're not talking about surgical masks or N95 masks. We're talking about anything that's cloth, and the CDC has even recommended bandana, something that you could easily breathe through. That will help to contain the droplets if you actually have the disease. Again, predictions are always fraught with the danger of being wrong. I have a feeling that the CDC is likely to come out with some direction in that regard. It won't be an absolute edict, but they're probably going to tell you that it's not inappropriate in certain circumstances to wear some type of covering over your mouth and nose that you could easily breathe through, and that would be discretionary. Is that helpful?
Yes, thank
Okay.
you.
You're welcome.
Any further questions, Rocky, Chris?
Yes, sir.
Doctor, I want to thank you so much for giving us your comments, your insight, your knowledge, sharing that with us, and thank you to St. Luke's Health Network. We appreciate everything that the doctors, the nurses, the support staff such as administrative and even the custodians and the people cleaning the hospitals and our healthcare facilities for everything you do. It is greatly appreciated by all of us here today, and to you, to the medical facilities, and to the first responders. Thank you.
Well, thank you. I will pass that on, and I also would like to say that we truly appreciate the support of the community that we've received. So it works both ways.
Okay. Thank you so much.
Thank you. Bye-bye.
Bye. Okay. Now we can go back to where we were.
Okay. We're going to go back to expenditures. Approval of payroll check numbers 72278 through 72316, and direct deposit check numbers 6018241 through 6018647 for the payroll paid through the payroll fund checking account for all county funds totaling $548,230.68. This is the payroll dated March 27th, 2020.
So moved.
Second.
Mr. Honor?
Yes.
Mr. Lukasevich?
Yes.
Mr. Notes?
Yes.
Approval of check numbers 212376 through 212456 for expenditures to the general fund clearing account totaling $190,649.40.
So moved.
Second.
Mr. Honor?
Yes.
Mr. Lukasevich?
Yes.
Mr. Notstein?
Yes.
The treasurer's report?
Move to approve.
Second.
Mr. Honor?
Yes.
Mr. Lukasevich?
Yes.
Mr. Notstein?
Yes. At this time, we'll recess our weekly meeting of the commissioners, and I'll call the monthly meeting of the salary board to order.
The first item is the approval of the minutes of the salary board meeting held March 5th, 2020.
So moved.
Second.
Mr. Severcek?
Yes.
Mr. Honor?
Yes.
Mr. Lukasevich?
Yes.
Mr. Notstein?
Yes.
Yes.
Are there any guests concerning salary board business at this time? Hearing none, we'll move on.
Report of executive sessions held.
There was one executive session held on March 30th, 2020 at 10:30 a.m.
Reports. Mr. Armstrong?
Change the rate of one secretary to $15.43 per hour, grade 7, step H, to $15.89 per hour, grade 7, step I, effective May 6th, 2020.
Motion?
Oh, wait.
Second?
Second.
Yeah.
Oh, you second. I made the motion, I'm sorry.
Okay,
I didn't
I'll
clarify
second.
that. Sure.
Okay. You made the motion. Okay. Mr. Severcek?
Yes.
Mr. Honor?
Yes.
Mr. Lukasevich?
Yes.
Mr. Notstein?
Yes.
From the Lansford office, change the rate of one secretary to $14.13 per hour, grade 7, step E, $14.55 per hour, grade 7, step F, effective April 8th, 2020.
Move to change the rate.
I'll second.
Mr. Severcek?
Yes.
Mr. Honor?
Yes.
Mr. Lukasevich?
Yes.
Mr. Notstein?
Yes.
Domestic relations, change the rate of one domestic relations director from $26.83 per hour, grade S 14, step C, to $27.64 per hour, grade 7, grade S 14 step D, effective April 15, 2020.
Move to change the rate.
Second.
Mr. Severcek?
Yes.
Mr. Honor?
Yes.
Mr. Lukasevich?
Yes.
Mr. Notstein?
Yes.
Domestic relations, change the step of one domestic relations specialist to $15.13 per hour, grade 6, step M, to $11.95 per hour, grade 6, step A, effective April 14, 2020.
Move to change the rate.
Second.
Mr. Severcek?
Yes.
Mr. Honor?
Yes.
Mr. Lukasevich?
Yes.
Mr. Notstein?
Yes.
District Attorney?
Motion to change the rate of one legal secretary, one from $13.45 an hour, grade 6, step E, to $12.68 per hour, grade 6, step C, effective April 8th, 2020.
So moved.
Second.
He made the motion.
Oh, okay. you did.
Oh,
Yep, we're
okay.
good.
Attorney Greig?
The second one is to change,
We have to call, roll call vote.
yes,
Okay, Attorney Greig, yes. Mr. Severcek?
Yes.
Mr. Honor?
Yes.
Mr. Lukasevich?
Yes.
Mr. Notstein?
Yes.
Okay.
and change the rate of one clerical specialist from $11.83 per hour, grade 4, step D, to $11.16 per hour, grade 4, step B, effective April 6th, 2020.
Second.
Attorney Greig?
Yes.
Mr. Severcek?
Yes.
Mr. Honor?
Yes.
Mr. Lukasevich?
Yes.
Mr. Notstein?
Yes.
And the third one that's on your agenda, I have a change to it. It's listed as change the rate of one legal secretary to from $14.98 per hour, grade 7, step G, and it would be to change that instead of going to step I. I'd like to make a request to do grade 7, step H, effective April 6th, 2020. Step H is H 1543.
1540.
Green?
Yes.
Mr. Severcek?
Yes.
Mr. Arner?
Yes.
Mr. Lukasevich?
No.
Mr. Notstein?
No.
Anything further, Attorney Green?
No, that's all.
Corrections. Change the rate of one live scan operator, corrections clerk, from $11.38 per hour, grade 5, step A, to $11.72 per hour, grade 5, step B, effective April 22nd, 2020.
Move to change the rate?
Second?
Mr. Severcek?
Yes.
Mr. Arner?
Yes.
Mr. Lukasevich?
Yes.
Mr. Notstein?
Yes.
Establish the position of one assistant site coordinator at $18.19 per hour, grade 14, step B, effective April 2nd, 2020.
So moved.
Second?
Mr. Severcek?
Yes.
Mr. Arner?
Yes.
Mr. Lukasevich?
Yes.
Mr. Notstein?
Yes.
PCWDA, establish the position of one caseworker at $15.26 per hour, grade 11, step A, effective April 2nd, 2020.
Move to establish?
Second?
Mr. Severcek?
Yes.
Mr. Arner?
Yes.
Mr. Lukasevich?
Yes.
Mr. Notstein?
Yes.
Children and Youth Services, change the rate of one administrator two from $36.41 per hour, grade S13, step O, to $24.09 per hour, grade S13, step A, effective April 2nd, 2020.
Move to approve.
Second?
Mr. Severcek?
Yes.
Mr. Arner?
Yes.
Mr. Lukasevich?
Yes.
Mr. Notstein?
Yes.
Change the rate of one county casework supervisor one from $20.82 per hour, grade S7, step F, to $17.98 per hour, grade S7, step A, effective April 6, 2020.
So moved.
Second?
Mr. Severcek?
Yes.
Mr. Arner?
Yes.
Mr. Lukasevich?
Yes.
Mr. Notstein?
Yes.
Abolish the position of one acting administrator two at $27.12 per hour, grade S13, step E, effective April 6, 2020.
Move to abolish?
Second?
Mr. Severcek?
Yes.
Mr. Arner?
Yes.
Mr. Lukasevich?
Yes.
Mr. Notstein?
Yes.
Establish the position of one county caseworker one at $14.53 per hour, grade 10, step A, effective April 2nd, 2020.
So moved.
Second?
Mr. Severcek?
Yes.
Mr. Arner?
Yes.
Mr. Lukasevich?
Yes.
Mr. Notstein?
Yes.
Abolish the position of one county caseworker two at $20.30 per hour, grade 12, step 5, effective April 2nd, 2020.
Second?
Mr. Severcek?
Yes.
Mr. Arner?
Yes.
Mr. Lukasevich?
Yes.
Mr. Notstein?
Yes.
Establish the position of two county caseworker two at $16.02 per hour, grade 12, step A, effective May 6, 2020.
So moved.
Second?
Mr. Severcek?
Yes.
Mr. Arner?
Yes.
Mr. Lukasevich?
Yes.
Mr. Notstein?
Yes.
Abolish the position of two county caseworker one at $14.53 per hour, grade 10, step A, effective May 7th, 2020.
Move to abolish?
Second?
Mr. Severcek? Mr. Arner?
Yes.
Mr. Lukasevich?
Yes.
Mr. Notstein?
Yes. Any further business for the salary board? Hearing none, meeting adjourned. At this time, we'll reconvene our commissioners' meeting.
Next item is the personnel report.
Move to approve?
Second?
Mr. Arner?
Yes.
Mr. Lukasevich?
Yes.
Mr. Notstein?
Yes.
Correspondence was received as listed. Copies will be made available to the press upon request. Advertising for ratification. Advertisement of a legal notice regarding the county's intent to enact an ordinance authorizing the issuance of general obligation bonds. Such notice to be published in compliance with the Local Government Unit Debt Act.
Move to ratify?
Second?
Mr. Honor?
Yes.
Mr. Lukasevich?
Yes.
Mr. Notstein?
Yes.
Adult probation for approval and execution of agreement between the County of Carbon and Lake Harmony Turismo LLC of Albrightsville, Pennsylvania, to provide transportation to participants of the treatment courts for 1 year, beginning March 1, 2020, and terminating February 28, 2021. Total cost, $60 per hour flat rate, billed in 15-minute increments. Charges not to exceed $15,000. A grant request was submitted to the Administrative Office of Pennsylvania Courts to offset the cost of the services.
Move to approve and execute.
Second.
Mr. Honor?
Yes.
Mr. Lukasevich?
Yes.
Mr. Notstein?
Yes.
Area Agency on Aging for approval and execution. A letter of commitment for the Carbon County Area Agency on Aging to support and partner with the Pennsylvania Association of Area Agencies on Aging on the request for application from the Office of Long-Term Living. The application is for the performance of specific tasks and activities to include, but not limited to, enrollment navigation services for the elderly citizens.
Move to approve and execute.
Second.
Mr. Honor?
Yes.
Mr. Lukasevich?
Yes.
Mr. Notstein?
Yes.
Bid awards. A recommendation was received from the Director of Planning and Development to award the CDBG contract bid opening on March 12, 2020 for the Beaver Meadows Borough Project to Franzosa Trucking of Hazleton, Pennsylvania at the bid price of $62,358.50.
So moved.
Second.
Mr. Honor?
Yes.
Mr. Lukasevich?
Yes.
Mr. Notstein?
Yes.
Another request to award the contract for CDBG bids opened on March 19, 2020. Palmerton Borough to Barker and Barker Paving and Excavating of Dutton, Pennsylvania at the bid price of $66,460. Summit Hill Borough, Interfield the Building to APM Construction at the bid price of $105,650. Summit Hill Borough, Interfield, the site excavation to Stony Lonesome Excavating of Summit Hill, Pennsylvania at $89,393. Eastside Borough, the street improvements to Barletta Materials and Construction of Tamaqua at the bid price of $104,822.50.
So moved.
Second.
Mr. Honor?
Yes.
Mr. Lukasevich?
Yes.
Mr. Notstein?
Yes.
CCT Lanta for approval and execution. The allocation letter from the Pennsylvania Department of Human Services for the fiscal year 2018-2019 MAT program, listing the final allocation amount at $655,661.
Move to approve and execute.
Second.
Mr. Honor?
Yes.
Mr. Lukasevich?
Yes.
Mr. Notstein?
Yes.
Human Services for approval and execution. The 2019-2020, October 2019 through December 2019, first quarter inventory participation report, and invoice and expense reimbursement request for the Carbon County Temporary Emergency Food Assistance Program.
So moved.
Second.
Mr. Honor?
Yes.
Mr. Lukasevich?
Yes.
Mr. Notstein?
Yes.
Mechanical Service Company for ratification. Service performed by Mechanical Service Company of Pittston, Pennsylvania for repairs needed after an annual generator inspection located at the courthouse, administration building, 76 Susquehanna Street, and Penn Forest Tower site at a total cost of $3,575 plus shipping.
Move to ratify.
Second.
Mr. Honor?
Yes.
Mr. Lukasevich?
Yes.
Mr. Notstein?
Yes.
Solicitors report?
Thank you. General obligation bond series of 2020. For adoption, ordinance authorizing and directing the incurring of non-electoral debt through the issuance of one or more series of general obligation bonds of the county in the aggregate principal amount of $10 million, specifying that such indebtedness is to be incurred to provide funds for certain projects of the county, which include the advance refunding of the county's general obligation bond series of 2016, payment of costs and expenses of issuing the bonds, and setting forth the remaining reasonable estimated useful lives of the capital project that are to be refinanced by the bonds.
So moved.
Second.
Mr. Honor?
Yes.
Mr. Lukasevich?
Yes.
Mr. Notstein?
Yes.
General obligation bonds 2020 for ratification and agreement with RBC Capital Markets LLC, the underwriter in the County of Carbon, to authorize the preparation of all necessary documents and take all required action necessary relative to the issuance of General Obligation Bonds Series 2020, refunding the outstanding series of 2016 bonds.
Move to ratify.
Second.
Mr. Honor?
Yes.
Mr. Lukasevich?
Yes.
Mr. Notstein?
Yes.
Susquehanna Group Advisors for approval and execution, agreement with Susquehanna Group Advisors Incorporated of Harrisburg relative to consultant services to assist the county with planning and execution of the issuance of General Obligation Bonds Series of 2020, to refund the outstanding series of 2016 bonds, compensation set at $30,000.
Move to approve and execute.
Second.
Mr. Honor?
Yes.
Mr. Lukasevich?
Yes.
Mr. Notstein?
Yes.
Public disaster assistance application for approval and execution. Public assistance application and agreement for financial assistance with the Commonwealth of Pennsylvania, Pennsylvania Emergency Management Agency to apply for disaster assistance funding due to the COVID-19 pandemic.
Move to approve and execute.
Second.
Mr. Honor?
Yes.
Mr. Lukasevich?
Yes.
Mr. Notstein?
Yes.
Public disaster assistance for adoption, a resolution authorizing the chairman to execute all documents relative to the submission of the public disaster assistance agreement for financial assistance COVID-19.
Move to adopt.
Second.
Mr. Honor?
Yes.
Mr. Lukasevich?
Yes.
Mr. Notstein?
Yes.
Nothing further.
Any further business? Commissioners' reports. Mr. Honor?
I think everybody can see we're pretty active in trying to combat this virus. And every day we're working on it. And I'll let my fellow commissioners comment on that a little bit. And I want to give a little bit on our day-to-day, what we're actually doing. But I'd like to say one thing about the virus. We're looking at other areas, and they might have 100 cases, and they might have 1 death. Right now in Carbon County, we have 25 people that were tested positive, and we have 1 death. Our rate is not very good right now, and I'm hoping that there are no more deaths, that if we get up to 100, our rate keeps getting better. But I think people got to realize, you got to listen, you got to stay at home, stay away from people. I mean, as the commissioners, we're here actually risking our day-to-day basis, but we're coming in here, we're staying apart from each other, we're rotating every other day, and we're trying to do that. But people got to realize how serious this is. And back to our day-to-day business, I mean, we're still working on children and youth, the courts, the aging department. I mean, every department within the county is working. But I want to hit on one issue that I seen last night, and I am glad that if we are helping New York by putting the fill in Palmerton, I think that's a positive thing in one way. But in another way, this has been an issue that has been going on since I think 2018. And one of the things that I'd like answers for, and I've been asking since I'm a commissioner, you know, what are the building codes required to build on this site? You know, from the footer to the height of the building. Was there a subdivision plan presented? I mean, everybody else that has a development or builds as a contractor, they have to submit a plan. Was there sewer, water, electric involved in this? I mean, and are they just coming in here and saying, okay, we're going to fill, and is this going to wind up happening that you can't build on it? I mean, when you fill 20 feet, there's different regulations for building a building. And where, you know, there was an issue of the wetlands. You know, normally when you destroy a wetlands, you should build a wetlands before you destroy that one. Where's the wetlands on that property? And was this site ever bonded? I don't think it was. You know, as the county, we have to bond everything. Why wasn't a project like this, you know, that had to be bonded? But like I said, it goes from here, and DEP, like even in some of these articles, I mean, this is a Times News, and yeah, I mean, everybody's been, you know, commenting on it, and it's approved fill right here, the original thing, and it says from the Environmental Department, or the Pennsylvania Department of Environmental Protection. This permit expires in 2024. Clean fill, which includes soil, rock, stone, used asphalt, brick, block, or concrete. You know, you cannot build on sand. You know, where is this? And yes, maybe it could be fill around buildings, but there's no plan here. And as the county officials, how are we supposed to create jobs and entice businesses to come in here, and we don't even know what kind of buildings could be put on this area? You know, and that's my dilemma. But like I said, we're working on issues throughout the county, and we're not going to stop at that. You know, business has to continue for us. But I think we have to have answers, and then they'll have this is appropriate fill. What is appropriate fill? I mean, a landfill that puts garbage, yes, that's appropriate fill. Or you go to a mitigation spot where they're putting radiation. Yeah, that's approved for that site. What is actually approved for this site for buildings? Thank you. That's my report.
Commissioner Lukasevich?
Yeah, I'm going to second Rocky's concern there. I think most reasonable, rational people were concerned with the headline and the spin that really was placed on the regulated fill that's going into Palmerton, implying that dredging and that dredged material being brought to Palmerton allowed the USNS Comfort to come into New York City. Well, of course, we're extremely grateful for the United States Navy and that ship being there. It just seemed a little bit inappropriate to kind of tie that into COVID-19. But on another COVID-19 issue, I want to thank the prison and the prison board for what they have done to mitigate the risk up there, both to our corrections officers, other staff, and those who are incarcerated. We saw the population drop from about 240 to 201 today, and that was with work with the DA, parole, public defender, probation, the courts, to remove low-risk individuals who might have been vulnerable to the virus and get them out of the prison to bring that population down. In addition, as previously noted, we removed or suspended visitation, work release was stopped, weekend sentences were suspended, and volunteer programs have ceased. So great job up there trying to mitigate the potential for what would be a true crisis within a crisis should we have a breakout in the prison of COVID-19. I will mention, I'm going to defer to Wayne when he speaks about talking about the name of a new CYS administrator, as we made some motions in regards to that for salary changes. We had 4 motions that were made today in relationship to more or less a modification to our Series 2016 bond. The commissioners came together about 4 or 5 weeks ago, saw a potential to save the county taxpayer money by going through a potential, let me call it a refinancing or reissuing of a bond. And that is going to take place at a savings to the taxpayer over the lifetime of that new issuance of about $647,000. That's net present value dollars. So thanks for my fellow commissioners coming together with our bond counsel and advisors to see an opportunity to take advantage of changing rates here. We spoke to Senator Casey today, and I'm only going to make one point on that. We continue to have a significant challenge in regards to information sharing. And it's not about who needs to know, but who doesn't know. And who doesn't know what? We don't know where these specific cases of COVID-19, the confirmed cases, are taking place. And why is that important? Because every day we are taking our first responders and potentially putting them into a viral hazard situation. Whereas if the Department of Health, St. Luke's, Lehigh Valley Health Network, would release the information, which is now authorized by the Health and Human Services Office of Civil Rights, if they would release the geographical data for emergency management use only, that would allow us to better protect our citizens who are our first responders in Carbon County. That's all I have. Thank you. Commissioner Nugent.
Yeah, we did have a conference call, as I alluded to earlier, when we had the doctor on the line, and I really thought that was informative, and he did an excellent job of explaining to the best of his ability and how things change. So again, thank you to St. Luke's and Dr. Jury. But we did had a conference call this morning. The three of us were on the line with Senator Casey, and basically it's the same thing for all the counties. All the issues are the same with people coming from out of state or other areas, a transfer of detention kids from Philadelphia into a remote county, possibly bringing the virus there. Things of that nature, the shortage of equipment and various other issues that we talked about from business, economic development, etc. So it was an informative session. Again, we had a meeting on Tuesday evening, a conference call with our local municipalities through the COG and keeping them updated and listening to their concerns. So we continue to work with that. One of the things I want to point out yesterday, or in the live broadcast, or the town hall meeting we had with the other three counties on TV 13, the grading of the county and the transportation, we think is why the county got such a low grading. And it was Wayne County, I think, was the other one that was very low on our report card, I guess you can call it, on the people that are protecting themselves, distancing themselves, the amount of traffic, and from what we can find, it's nothing that we really doing. Maybe other than that, we can't stress enough to stay at home. And the amount of traffic, I have noticed a difference in the last several days. It's getting better, but we need to certainly improve in that. I want to tell the people now that the more you shelter in place, keep your distance from even family. I know Easter's coming up. I'm going to miss coloring my Easter eggs with my grandchildren, but that's something we can do at another time. It's those dinners, the family gatherings. You got to protect yourselves, your elderly parents, such as me, and, even with being with the grandchildren. But we can't stress that enough. And the doctor alluded to that today several times in his comments. That the sooner we commit ourselves to not going out when we don't have to, the sooner we're going to get through this. But if people continue to ignore the recommendations of the CDC, Department of Health, the governor, and staying home and even washing their hands in their own home, my wife is really on my case all the time, wash my hands before I touch anything. And so if we want to get through this quickly, we have to start now, and everyone has to do it. So I can't stress that enough. And the other thing that Chris wanted me to bring up was we have a new administrator now, Children and Youth, Jill Geisinger. We had taken applications from within first to see what kind of response we would get. We had 2 applicants. Both of them were extremely good applicants. And one of our most difficult positions, or decisions so far this year, other than the coronavirus, of course, is who was best qualified for their job. And it was a fine line. We went with Jill, Marianne Grebowitz, been there a long time as well. She's both of them were caseworker managers. We had 3 of them. The third one didn't apply. We felt after the interviews there was absolutely no need to go out to the public and advertise, which would have taken more time, and we wanted some stability in that office. It's an extremely important decision. I feel that the caseworkers there and the caseworker managers will work together. We're looking forward to, in our interviews, one of the specific questions was, what are some of the recommendations you would possibly make? How would you restructure the office? And how would you handle a lot of the things in the office differently? And I think all three of us were impressed by both the candidates and their answers and their ability there. So again, it's one of the worst parts of our job when we have to call someone in like that and say, you have the job or you don't have the job. It hurts, but we feel we made a good decision. Either one would have been a good decision. So I think that's enough for today. So it was a long meeting, but well worth the doctor being on the line. So any other comments, Rocky?
No, sir.
Okay, meeting adjourned. Haley.
Commissioner Lukasevich, you had mentioned that you want the geographical data. Does that come from the state? Are you reaching out, trying to get it?
Well, actually, we've been advocating for it. We actually had, and on our behalf, Senator Yudichak and Representative Heffley sent a joint letter to the Department of Health requesting that information. I spoke to our our 911 director this morning, and he assured me we were still not receiving the information from either the hospitals or the Department of Health formally. And that's why we took it to the next level today and asked Senator Casey to see if his offices here in Pennsylvania could intercede on our behalf to again provide that information that Health and Human Services has already authorized for release. It's kind of a modification of the current HIPAA law.
And I would say, just to add to that, Chris, that it's more the Department of Health. They get all the reports from the different hospitals.
They do. Yep.
The hospitals have been very cooperative here in
been
Carbon County,
Yeah.
and an example
Yeah.
this morning. So all we
Yeah.
have to do is call those people, and they do
Yeah.
whatever they can for us. But
Yeah.
It goes back to the Department of Health
Yeah,
is
because
really
all that
reluctant.
funnels up to them, and we don't want to, 10 different people calling into us, 10 different facilities. The Department of Health brings it all together and disseminate it right down on a daily basis, like the daily updates they already do. But again, this is for emergency management use only. You know. Yeah.
That's all I have.
Oh, Alyssa.
Yeah, just for clarification, the Children Youth New Administrator, you say Jill was the name?
Jill Geisinger, yes.
Jill, and then last name.
Yeah, we'll give you the correct spelling there. Yeah, yeah, it's on the first. Yeah, it's on there.
Name's on there?
Yep.
Okay, cool. Then I have that.
And the proper spelling of the doctor. Let me go back to my note here. Jeff Gerard J. Wait, what the hell? Oh, I didn't say that, did I? Hey, that's not the worst thing I've ever done. Okay, I could have put the glasses on here. Dr. Jeff Gerari, Jahre, MD, Senior Vice President of Medical Affairs for St. Luke's Health Network.
You said Jahre?
Yes.
Okay.
Okay.
And then the disaster financial assistance, that's money that you guys, I'm assuming all the counties are probably just applying for financial assistance?
Basically gives us the ability. It's the agreement. It's more the legal end of it, the auditing, the stipulations they have in there that non-discriminatory. There were like 42 things you will do this and everything, and that's what that was all about. It's just a legal document applying for the loan that you will abide by all the rules and do the audits and follow the procedures and standards and all that. So.
Okay. And then the only other thing that I have, I just want to, the doctor kind of alluded to it, over in Monroe County, obviously, they're having a serious problem, and St. Luke's has confirmed that they're at capacity with the hospitals there. Obviously, in Carbon County, our healthcare facilities are limited. How prepared is Carbon County if it comes here? Because like the doctor said, you have to assume that we're next.
I had talked to the hospital yesterday. They will be putting up a tent. I purposely drove by last night and they didn't start putting it up, but they were hoping to have it in service tomorrow on Friday. with all the proper equipment, oxygen, and more of a triage center for those that have the COVID-19 symptoms. They'll come in, triage them, and act accordingly. Now, if you have an automobile accident or other cases, will directly go to the ER. But they're setting this up. Right now, they have an area where they do separate those victims from our patients from the rest of the staff. They are taking all the precautionary measures, the gowns, the face masks, and all that stuff. So we should be seeing a tent going up very soon here.
That's at Maiden Hutton, the campus in Maiden, right?
That's what I understand, yes.
Is that the only facility where patients are being treated, do you know?
In Carbon County, as far as I know, yes. I'm not sure if they're doing it through their express cares or urgent cares or anything like that. I think they're
I know the doctor did mention that they were testing in
Testing
additional
in the other-
facilities.
Yeah,
But I don't know where if they ask them to self-isolate or quarantine
Yeah.
or have beds.
Right, I mean, is that a concern, only having that one facility for treatment?
As of now, well, the caseload I think is low enough. It's manageable. Most of these have been shelter in place, to my knowledge, and because of the HIPAA violations and things of that nature, they can't give out a lot of the information that if somebody is on a ventilator or anything of that nature, that we have not been given that information.
I think that's pretty much it. Oh, the only other thing you mentioned when you guys were talking to Senator Casey, something about a detention center from Philadelphia being moved to, is that?
Yes, one of the counties on there, I forget which one in the north central part of the state, where they were concerned because they were transferring juveniles from a detention center in Philadelphia to their facility. So it's a great concern to them as well. I think that was at 9 or,
Eight individuals, 8 youth,
Eight-
right? 8 youth
something
were
like that.
being transferred to
Yeah.
Okay.
but still the idea of transferring those, and we're concerned even in the prison facilities, the transportation of one facility to the other, and I know the sheriff and the judges have had conversations on that as well. Okay, good enough. Let me get out of your way
Get
before
away
you walk
from me.
behind me. Oh.